So maybe tell me a little bit about, the downtime and like the healing process of this. I think a lot of people are afraid to do plastic surgery, not just because, there are like social stigmas that still exist, unfortunately, but, people are afraid of like bruising, downtime.
Absolutely. I would say over 90% of my patients getting cosmetic surgery are coming in for the first time. They've never had surgery, so they're scared.
Yeah.
And the common fears are, am I going to be in a lot of pain? Is it going to hurt a lot? Am I going to wake up?
Yes.
I'm scared of going under.
Exactly.
So these are pretty common concerns that people express. And the fact is, you are safer to be in this operating room, in this facility, than to actually step out on the main street outside of New York, because you're more likely to get hit by a car than something bad happening here. When it comes to general anesthesia, which is one of the most common source of anxiety for patients, I tell them it's like going to sleep. You go to sleep every night here. We're going to give you some really, really strong sleep medications. You're going to pass out. You don't feel anything. And when it's all over, our anesthetist will turn off the medication, and a few seconds later you wake up. I never had anybody not wake up.
Yeah, that's a good record.
Just
keep it like that. Yeah.
Patients are very, very anxious about it. I understand. Yesterday, I did a procedure on a very young girl. She was very, very sweet, but she was very, very anxious. And when she woke up, she was the happiest person. She was so excited. I'm like, great. And then it really turned out that she was so scared of not waking up.
Yeah.
She actually gave her banking information to her friend just in case she doesn't wake up.
Yeah.
Once you have the surgery, we don't kick you out. When you become a patient at this clinic, you become a patient for life. We follow up on you. We see you after surgery several times. And after you're fully healed, after you're completely done, we'll still stay in touch with you. We get our patients to come back every year for a checkup just to make sure everything's healing well, if there's any maintenance that's required.
Yeah, well, that's really good. You do lifts as well, liposuction.
Absolutely.
So you have, a whole array of surgeries that you're capable of doing. Do you ever feel that, how did you decide that, you want to do all of these, instead of just like specializing in one? Do you feel that you're equally as good, at every surgery that you do?
Well, I specialize in plastic surgery. There's a lot of different surgeries. There's a lot of different things a doctor can do. I specialize in cosmetic plastic surgery and reconstructive surgery. So in addition to cosmetic surgery, I do a lot of breast cancer reconstruction. It's one of my passions, and a lot of hand surgery. But when it comes to cosmetic surgery, I do a lot of different procedures, and I don't see them as a lot of different things that I'm spreading myself wide, because this is all sort of based on the same concept, and I love what I do. I wanted to do this ever since I was a little kid. My dad was a plastic surgeon, so I've seen all of this since I was growing up, and frankly, I can't imagine myself doing anything else but plastic surgery.
So in terms of costs, I guess there's like, a wide variety depending on what you want to do, but what are some of the ways that, patients could kind of finance? I guess there's some sort of financing so they can help pay for it?
Most of our patients actually pay for the procedures on their own. I would say maybe about 20-30% finance. When it comes to financing, we do offer financing. This is done through a third-party company. There's 2 companies in Canada that do this that we deal with, and what happens, patients apply to them. Their credit rating has to be checked, their source of income has to be verified, and once this is done, they get approved. And it usually takes about 24 to 48 hours, so it's really, really easy. If you're a good candidate, you get approved. If you're not, you can reapply with a co-signer that qualifies, and that way you can finance your surgery.
So how much is it for a breast implant?
So the breast implant prices will depend on how it's done and what type of implants you choose. So very simple, very, very basic breast augmentation starts at $6,500, can go up to $8,500, and if it's a complex breast augmentation that requires lifts and any other procedures to improve symmetry, it can go up to $10,500 or more.
Does the price go up according to cup size?
No, it doesn't. So if you go for a B cup or a double D, it's still the same.
So what about butt lift?
Brazilian butt lift starts at $8,500 for basic Brazilian butt lift, and sometimes people want additional liposuction, which adds additional cost and additional procedures.
Would you like to take us for a tour of your facilities?
Show
us around?
Absolutely. Okay. Come along. This is one of our consultation rooms where we see patients for consultation and also do some breast implant sizing. If you come this way, you'll see the reception over here, and here's our Nora and Stephanie, who always greet our patients. I'll take you down the hall. On your left side is our main consultation room. Here.
Oh, that's nice.
We have patients sitting over here, and we have a nice large screen TV, so we can look at before and after pictures. If we need to do any computer simulations to predict what they will look like after surgery, they can sit on the couch and see it all on a nice big screen. Okay. And wait to have their surgery.
Okay.
They relax here, we get them to change into their gowns, and then I come and meet them before surgery. We talk one last time before they actually go under, and I take before and after pictures, and I do any markings that we need to do. And I will call the wall. So this is our recovery room right here. After surgery, patients come in here, and we have 2 stretchers with monitors and all the equipment to make sure they're comfortable as they're waking up. Once they have woken up, we transfer them upstairs. What's different about our facility compared to anybody else in Canada, as far as I know, is that we keep you here in the Royal York Hotel. So you don't go home, you don't stay in some room inside the clinic. We actually go to a Royal York Hotel room. Beautiful, state-of-the-art facility, beautiful, luxurious rooms, room service.
Room service.
It just doesn't get any better. It's the world's greatest private hospital, as far as I'm concerned.
So does this apply for every surgery?
It applies for all major surgeries.
Yeah.
So if you've had general anesthesia, we keep you overnight. And that's all included in the price, so we don't charge extra for that.
Wow.
Okay. And after the surgery, like what's happening right now, we've operated all day yesterday. Our nurse is actually upstairs seeing all the patients, checking on them so they're good and safe before they go home. All right. So come on in. And this is the real playground. This is where I play. This is our OR. We have the OR bed, the anesthesia machine, and all kinds of equipment that we use to perform the surgeries and keep our patients safe while the surgery goes on.
So when you have the surgery, how many people are here? So you usually have like the anesthesiologist.
The anesthesiologist is here, a scrub nurse, a circulating nurse. Behind us is our sterilization area, so there's always somebody in there cleaning instruments, preparing instruments, so we're all set to go. And of course, I'm here as well, having fun.
Thank you very so much informative information. You know, if you want to increase your cup size, decrease, men, if you want to decrease your cup size, you know, you could come here and speak to this wonderful doctor. Well, thank you very much.
Thanks for coming. It was great having you.
So how do we get a hold of you if
the best way is to find us online. We're on torontosurgery.ca, or you can call us at 416-834-6640.
Well, thank you very much.
Thank you.